wonderful things about IUDs, is especially the Mirena, is that it helps with prevention of pregnancy, but we can also use it for heavy cycles. Different women come to birth control for different reasons. And this is one great reason if you're having a hard time with your cycle and you want to prevent pregnancy. The Mirena is now guaranteed to prevent pregnancy up to 6 years, which is really nice. And there's also a copper IUD called Paragard. It has no hormones in it, and that's 10 years of solid coverage. And these are just as effective as having your tubes tied, which is really nice and less invasive. Tear down, you're going to have the depot shot, progesterone based, every 3 months. Downsides to the depot shot, it does actually tend to be associated a little bit more with weight gain. You're also going to have the birth control pill. Oftentimes, women don't have other medical problems for which they take a pill every day, which makes remembering to take the pill kind of difficult. I say set a timer on your phone. The pill is a combination of estrogen and progesterone. The pills at the end tend to just be sugar pills. There's also the ring, Nuva ring. Put it on up there, kind of looks like a Livestrong bracelet. Pull it up for 3 weeks, out for 1. There's also the birth control patch. You put a new patch on every week and then leave it off for a week. Downside, especially during the summer, people don't like their patches to show with their bikinis. And then also if you're getting in and out of the water, sometimes it can kind of fray at the edge of the patch a little. And kind of going down from that, our next level down are going to be condoms, which is going to be very dependent on use. A lot of times with my teenage patients, I'll also reinforce, your partner may not have perfect juice, you may not have perfect juice, it's better to have. I like to view condoms as more appropriate for preventing sexually transmitted infections and having them as a backup method. You're on a more reliable long-term birth control, but maybe it's a new partner and you want to have additional protection from sexually transmitted infections, especially if y'all have other partners. A lot of times parents are concerned about how young to start birth control. And I would say if they have an established cycle, so the first time that you have your cycle, there can be up to a 6-month gap, before you're starting to have them on a monthly basis. But if your daughter has a regular cycle and can become pregnant and is sexually active, or you suspect that it's even a possibility, make an appointment for her, to go talk to your doctor or to an OBGYN, and because she would be a candidate for birth control. I would say for any form of birth control is talk to your doctor, personalize it. What worked for your friend and their friend, you hear one horror story from one friend and you swear off a whole class of birth control when you don't even know, how it's going to affect you.